Hey everyone, welcome back to my channel. If you're new here, my name is Naomi and I am a NICU nurse. I've been working in the newborn intensive care unit as a registered nurse for almost 2 years now, which is crazy. If you don't already know, I started in the NICU as a new graduate RN. I am here today to talk about what a typical shift in the NICU looks like as a registered nurse, because I feel like this is a video that I would have been interested in watching before doing my clinical placements in the NICU. So of course, I just want to start this off. Your day is going to look different depending on what level NICU that you work in, but it'll kind of typically, they kind of follow the same schedule as far as feeding and basic things like that, as well as every day is different in the NICU. No 2 days are exactly the same, that is for sure, and that is one of the reasons that I absolutely love my job. So I thought that I would do this first video on a day shift. If you're interested in a part 2 talking about a night shift, I can do that as well, because there's certain tasks that are unique to night shift, so I would love to make a video on that as well if that is of interest to you all. Starting off, day shift. I typically like to arrive around 6:45, but nurses will be flooding in anytime before 7. That's just the way that our unit works. So when we first come in, first thing I do is I go to the assignment board. On there, you can see what your assignment is for the day. Now, working in a level 3-4 NICU, I will usually have 1 to 2 patients per shift. So once I see my assignment, I grab the appropriate number of report sheets, which I will insert a little video clip of what those look like. Report sheets are just super beneficial. They are so helpful to organize out your shift, and I write literally all over mine. I love checking off tasks, and they are great for organizing patient history and any relevant information that you will need in a quick second. So after I get my report sheet and see my assignment, I will walk to my assignment room. Depends on the layout of the NICU, but ours, we have 12 different rooms. So I'll head to where my assignment is and I will get report from the night shift nurse. Report usually can take anywhere from 5 minutes. If you're familiar with the assignment, say you're on for a set and it's your second day or third day coming back, then the nurse will just maybe give you updates. Or report can take 15 minutes, usually, sometimes longer, but mostly 15 minutes. So after I get report, I then will do my safety check. So that is just making sure that all my important equipment is working, like my bag mask, my suction, making sure that the oxygen tank is filled with oxygen, checks like that, looking at the patient's armband, and then I will chart that in the computer, because if you don't chart it, then you did not do it. And then after I do my safety checks, I will usually, if my patient is feeding, I'll draw up my milks for the entire shift. Then that is done and out of the way. And in the NICU, babies will usually follow either a Q2 or Q3 feeding schedule. So Q2 every 2 hours or Q3 every 3 hours. And then Q2 feeders will feed at my unit at 8, 10, 12, 2, 4, 6. And then Q3s, it's 9, 12, 3, and 6. And it might be a little different depending on the unit that you're in. The feeding schedule really dictates your day and your baby's schedule for the day. So Q2 feeders, for example, we do assessments on, now this is dependent on the baby, let me specify. You know your patient, so it really depends on the patient when and how often you assess them, but just typically Q2 feeders we will assess at 8 a.m., 12 p.m., and 4 p.m. And then for our Q3 feeders, 9, 12, 3, and 6. So pretty much every time that you're feeding, give them a little handle. Depending on your patient, it will depend how many meds you have to give throughout the day and what time those are. So as well, that is a part of your shift for sure, giving medications. After I've drawn up my milks, next thing I like to do is then assess my patients. So first assessment, I do chart because like I said, if you don't chart, then you did not do it. And I'm someone, I like to stay on top of my charting. Like, I don't like to be behind. It stresses me out. So I try to chart. I mean, some days are busy, but I try to chart right after I do something. So after first assessments are completed, I will chart. Rounds usually comes around 9:30, 10 o'clock-ish. It depends on the morning that we're having. And rounds is just pretty much where the entire medical team comes to the baby's bed spot, and we just make sure that everybody's on the same page, everybody's aware of what's going on with the patient's current medical status, and we all make plans for the future. So we all are aware and know what the plan of care is. Usually the medical team that will come for rounds can include a dietitian, medical doctor, bedside RN, pharmacist, respiratory therapist, etc. And residents and fellows, a lot of people at the bedside, and sometimes parents too. So after rounds, I usually like to go for my first break, which is my morning break, and I get a half an hour in the morning. So sometimes I like to go to Starbucks, get a coffee, or just sit outside by the windows outside of the unit and get a little bit of sunshine. Once I come back from morning break, then it's usually close enough to kind of start preparing for my afternoon 12 o'clock assessments and feeds, because especially if you have two babies, you kind of get started around 11:30. After I do my second assessments, like I did before, I will sit down, chart. Every day is different, depends on your patients, if they have procedures that they have to go to, tests, or sometimes things like ultrasound will come to the bedside, x-ray. Like I said, your day is so unpredictable, especially in a level 3-4. You never know how the day is gonna go. As well, on day shift as opposed to nights, we do not have private rooms, so families cannot sadly stay in the NICU with their babies, so they'll come visit mostly on days, which is always really nice. And sometimes you can get the patient out for a cuddle with their parents or their family members if they are okay and safe to be held. I usually like to take my second break. We take 2 breaks per shift. So my second one is the longer one. It's an hour, and it's so hard to say what time because it really depends on the shift, but I usually try to take it at a not super late time because I try to keep my eating on schedule so my body doesn't get all out of whack. So usually I try and aim for like 2:30, depends on when my babies are feeding or what's going on. And then if I get to take my break at 2 or 3, by the time I come back, organize things that I need to organize for the rest of my shift, I will maybe start doing my third assessment. After that, you might have to do a full line change, which can take a lot of time, and you need to account for that and not leave that to the end of your shift if possible, because line changes are done on days. If a full line change doesn't have to be done, every day, babies that are receiving lippets or SMOF, the lippet line is changed on my unit. So I will do a line change with that. If the baby was started on any new fluids, maybe those would be started then as well. And we always change our fluid bags and syringes at the end of day shift, so I will do that. So I do that if my baby has access. And I will note that most of our patients do have access given the high level of acuity we see in the level 3-4 NICU. So after I've done my line changes, if my patients had access, it's usually kind of like a lull. Things kind of settle down. I will go grab milks if I need them, because if my baby is getting breast milk or fortified formula from down in the milk room, they will bring up the fresh supply for the babies at around 5:30. So I'll go grab that, and that is what we use for the 6 o'clock feeds. So side note, when I draw up my milks in the morning, I draw up every feed except the 6 o'clock because we always draw that up fresh when the new milks come. So after I do final feeds, then I sit down, chart my life away. We usually at that time will finish up your end of shift note. And then I wait for my nighttime nurse to come to give report to, and that is pretty much my day. If you would like to know more about what nights entail and some differences between days and nights, let me know. I hope you enjoyed this video. Thank you so much for watching.